Right, welcome back. The Limpopo Health Department says the Jane Furse Hospital near Burgersfort has been partially reopened. The hospital was closed for more than a week due to flood damage caused by a storm. For more on this, we're joined by the Limpopo Health MEC, Dr. Poppy Ramathuba. Now, MEC, thank you so much for your time. Now, we understand that the hospital was significantly damaged by the storm. How has it affected, operations at the hospital? Please give us the latest update.
Afternoon, Onati, and then afternoon to all your viewers. We want to indicate to say, of course, the damage was so severe that we were forced to close the hospital, and unfortunately, our people were deprived services, mainly the emergency healthcare services that they were in so much need of. However, we had made arrangements with nearby hospitals, which of course is still an inconvenience, because most of the patients travel almost more than 80 to 100 kilometers to go to that hospital. So when you extend another 70 kilometers for the relatives to visit their loved ones who are in the hospital, it has been difficult. So since last week Friday, we've been working very hard to try to restore to its normality. As we speak today, we've been able to open our maternity ward, which was the main focus of concern, because St. Rita's Hospital, which is the nearby facility, was also getting to be overcrowded. And if we didn't make this provision of opening Jane Furse, we were going to again have another disaster, which will be infection control. When you speak of overcrowding, you can have an outbreak of infectious disease, especially on the newborn. So we didn't want to have that. That's why our focus and energy has been to make sure that maternity becomes functional. However, we are still having challenges with the theater itself. The main problem is not that we have not completed the cleaning and the fixing of the roof and ceiling, but the challenge becomes the equipment that we are currently using. To give an example, an anesthetic machine, your X-ray machines that we are using, they require some board of certification, wherein quality assurance must be done, and there are only few companies which are accredited who can do that. Most of them, when we contact them, they are on festive season. They've closed, unlike us. And unfortunately, we can't start operating those equipment on the human being unless those expertise has given us thumbs up. So that is what is really delaying us to have the hospital fully functional. Otherwise, we were going to, if it was not for that. And the other issue is, as we have indicated, the water has done serious damage, because most of our equipment, when we always said the challenge is not that we couldn't have power supply. The other challenge was our equipment are on the floor. For instance, all our 3 dental chairs, as we speak, the clinical engineer was on site. She has looked at them and she has given us a report that you will have to replace them completely. They've been damaged because some of them are mounted on the floor. Your X-ray processor also has been declared to say you will need to really go for a new one. Our ultrasound machines. So the damage really, that's why we're even failing to quantify it at this particular time. Because on a daily basis, we are being given complete reports, different reports to say this equipment is also condemned, this one is bad. But we reassure the people to say maternity is now functional. As we speak, we've got 17 patients who are in labor. That tells you how busy the facility is. They've already delivered 4 women since this morning. So you can see it's one of the facilities that is highly being utilized by the community in terms especially of maternity services. We are reassuring them that the outpatient, as soon as the X-ray, we get a thumbs up, we will be able to. But otherwise, laboratory services, they're up, they're working now. We were able to, our pharmacy, it's now working. But we're still really working hard to restore everything to normality.
All right, MEC Dr. Poppy Ramathuba, thank you so much for your time. Now,